The healthcare workforce shortage. This is a controversial topic because not only is there a shortage of healthcare professionals, but they are also distributed unevenly because these professionals are clustered in one area, for instance, like they want to work in an urban area versus a rural one, right? Who can blame them? I will tell you one thing that is that these factors are only part of the story. It's part of the story on why we have a shortage today. See, you may ask then, what is the entire story then, right? Why do we have a healthcare workforce shortage today? Well, first, we need to reframe that question. The question should be, do we have enough healthcare professionals to serve the healthcare needs of our population? See, my hope is that when you hear it that way, you can start to appreciate the urgency of finding a solution to this problem, right? Because you can appreciate how this healthcare shortage issue, right? This healthcare professional shortage issue can actually impact you and your family. But also, it is framed this way so your ideas for solving this issue can be more innovative than just simply graduating more medical students, right? That's not the solution, right? Because look, the United Nations has made this a high priority in addressing this crisis already, right? Because it is critical for them to have this solved in order for them to achieve one of their most important targets in their sustainable development goals. That's right. If you have not heard of the United Nations Sustainable Development Goals, then you should seriously look into it. In a nutshell, basically, the United Nations created this concept called Sustainable Development Goals as a set of goals for them to achieve global good. That's right. They basically created these set of goals for them to achieve global good for the entire planet, ladies and gentlemen, the entire planet. All right? Anyhow, the healthcare workforce conversation, although it's important, is also very complex. And simply seeing it from the supply and demand perspective, you will certainly fall short in understanding this complex issue, especially if you think we are just talking about the supply of just physicians and nurses. Not only there are other players that support the healthcare delivery of people in our country, such as therapists, for instance, managers of healthcare organizations, administrative assistants, and other supporting staff members, right? So there's a whole cadre of people. You see, if you were to look at it from the lenses of our traditional economists, you would certainly create a false narrative about this. In medicine, both the supply and demand are highly unpredictable. For starters, we cannot even accurately measure the number of illnesses or diseases that will occur in the future, yet discern how much healthcare workers we will need for that. It's like asking me to predict how many of you are going to suffer a heart attack tomorrow. Like, really? If someone dressed up in a suit, for instance, or a suit and tie, presents a fancy PowerPoint to you and is showing you complex predictive models and stating that they can make an accurate prediction of this, and that, look, I'm begging you to please run away from them as fast as you can and don't look back. They're as good as making predictions as the taxi cab driver that took you home from the airport the other day. Okay? In fact, I'll even say this. If I were to choose who would come closer to making a prediction, I would put my money on that taxi cab driver, hands down. So please, don't let no one fool you. All right? Although we can come close to understanding historical data and identify people with the highest risk of morbidity and mortality, but making predictions? No, not me. Please don't get fooled by people who are trying to tell you that they can make accurate predictions of the magnitude of diseases or pathologies we will be facing in the future, yet alone for them to tell you how many healthcare workers and professionals we will need in order to handle that amount of diseases. Okay? Now that we got that out the way, this healthcare workforce issue gets even more complex. When we think about, for instance, all the different types of providers that are there to help physicians, for instance, to manage the population, you start realizing that, okay, how can we start addressing this creatively? That is right. We have, like, for instance, nurse practitioners, PAs, therapists examples, right? These providers also come with a clear restrictions on competition and strong governmental interference that limit their capacity to practice. So just simply counting the number of providers and physicians still won't be suffice in understanding this workforce issue. healthcare is also the only industry where supply can create a demand. Yep, I said it. The father of economics, Adam Smith, will roll over his grave right now and understand to know that demand that predicts supply does not always add up in healthcare. The ability for the supply side to create its own demand through healthcare discoveries and innovations happen all the time. For instance, like Ozempic, for instance, all of a sudden now there's a demand. You see? I hope you can start to appreciate the complexity of this workforce issue in healthcare. There is no definitive approach in addressing the issue of healthcare professional shortage. There is no magic bullet. Nope, not at all. Don't let anyone fool you neither to tell you that there is. Some healthcare organizations or stakeholders talk about their respective approaches to these issues as if they are selling a used car. You know, it looked good driving it off the lot, and then months down the line, the wheels fall off of it because they forget to tell you that you will also need a new axle. You see, their particular approach may help in one aspect, but their approach certainly won't be able to do it alone. Okay? For instance, this thing about nurse practitioners solving the healthcare workforce issue, nope, I love nurse practitioners, but that's not going to solve it. I don't think so. They may ease the shortage, but solving it is certainly a stretch. There are 4 major popular approaches that you are hearing policymakers are talking about nowadays, right? And for instance, we can break it down into these categories. So for instance, number 1, they talk about innovation around education, right? Increase the number of medical schools, for instance. But we'll need to increase the number of the entire pipeline, right? Such as residencies and fellowship positions. Or they might even consider recruiting foreign graduates, right? Will that work long term? Probably not. How about the innovation in regulatory constraints? Recognizing overseas qualifications, can we guarantee the same quality if that happens? Or enhancing the scope of practice, such as nurse practitioners, being able to do more. But what happens if we lose nurses to advanced practitioners? Do we worsen the nursing shortage in hospitals and other places? I mean, there's innovation around financial incentives, right? They talk about increasing the salaries of trainees. Maybe residency won't be so bad after all. But solving the issue, I don't know. Establish retirement policies for professionals, sounds good to me, right? Or increasing the wages of healthcare professionals. Would more people want to spend more than a decade of their lives just to become a doctor? I'm not sure. Innovation around professional and personal support, for instance, they talk about safe and supportive working environments. Would that make more doctors live and work in the hood or rural areas like the mountains of North Dakota? I mean, shout out to North Dakota. I've never been there, but I'm sure it's a pretty nice place. But look, I'm a city boy, you see? You might not be able to be my first choice, but I think it's nice over there. But how about this other aspect, like better living conditions? I mean, if I am going to work in a rural location like North Dakota, I still need to be able to see some of my Broadway shows, guys. You see that? So, you see, although this issue is complex, it is still simple in my eyes, though. We just need to keep working together. See, this problem has been a topic since 1950s. Do you believe that? Since the 1950s, healthcare shortage has been an issue and a topic of discussion. And now it is 2024, still in the conversation. This clearly means it has not been solved, right? Or maybe the approaches we are using are not it. Especially if we're trying the same approaches. I mean, that's right, isn't doing the same thing and getting the same results is the definition of insanity? Okay. Anyhow, I do know one thing for sure. We need to be integrated in thinking about this as a collective, since we now have multiple players in this healthcare industry now, right? Moreover, I believe we need a coordinated and concerted efforts of these players to address this healthcare shortage issue, right? That means everyone needs to play ball and play nicely together. Physicians, nurses, governmental officials, healthcare insurance companies, and even healthcare systems, right? We all need to work together to address our population's current access issues and future ones. If you know of any ideas of how to address this huge issue of healthcare workforce shortage, please comment below. Anyhow, I'm Dr. Coupe. I'm the people's doctor. Thanks for listening.